And we are starting with section 1, that is anatomy and physiology of three system, out of which the nervous system. Which two parts, organs you want to discuss about nervous system?
Nervous
First is neuron, brain, spinal cord, and meninges. Which two?
I'll go with the brain and the meninges.
Okay. Moving to the brain. What this organ is?
So that's the full brain.
Okay. Could you please label any 6 parts of the brain?
So this is the cerebrum, and then we've got the pons, we've got the medulla oblongata, and then we've got the pituitary gland, and then we've got the hypothalamus, and then the thalamus on the top of it, and then we've got the cerebellum here.
Okay, all good. Give any one function of the brain.
The brain is the one that controls all body functions,
Like
intellectual, sensory, motor.
and you next you want to discuss meninges?
Meninges is the one.
Okay. This
Okay.
could you please label this for me?
So the first part, the top one for the meninges is the dura mater.
Is this a dura mater? This one?
No, this one, the one.
What do you see over here? What is this part?
That one is the hair shaft in the skin area and
Then what we
tegmentary.
call this as a
Sorry.
what we call the hairy part, or what we say. Okay, move on.
And then the second one, which is like this one, the spongy one with spider thing, is the arachnoid. And then below the arachnoid one is the pia mater, which is the thin sheet area layer of
Any other three parts you can
meninges.
see from the diagram?
Other 3 parts, so we've got, I'm not sure if this one is a blood vessels.
What we call the inflammation of meninges.
Meningitis.
Okay, moving to GIT, which two parts you want to discuss? Liver, pancreas, stomach, small intestine, upper GI.
Stomach and small intestine.
Okay, moving to stomach. Could you please label this for me?
So the top one is the cardia, and then the fundus on the upper one, the body, and then the antrum and the pylorus.
What this part called?
Cardia. The sphincter.
What we call this sphincter?
The sphincter is the one that locks.
Name of the sphincter?
Hala. I forgot the name of the sphincter.
And what is above sphincter? What is connecting to
The one connecting to the sphincter is the esophagus.
And what is connecting to this after the sphincter?
It's the duodenum, or the part of the small intestine.
Give one function of the stomach.
Function of the stomach: storage of food
So,
and digestion of
how the
breakdown and
food is
digestion.
digested in stomach.
So they are stored on the fundus area. So by churning and grinding.
Is there any secretions in the stomach?
Secretions that help with the breakdown of foods. So we've got the bile.
Bile in stomach?
No, bile is in the liver area. Gastric acid.
And could you please show me from where small intestine starts?
Small intestine is here.
Okay. Name the parts of the small intestine.
So we've got the duodenum, the jejunum, and the ileum.
Give one function of the small intestine.
Small intestine is where absorption, further breakdown and absorption of nutrients occurs.
moving to the endocrine system, which gland you want to discuss? Thyroid, parathyroid, and adrenal or pituitary?
Sorry. What are-
Thyroid gland, parathyroid, adrenal or pituitary?
Adrenal and pituitary.
And okay, moving to adrenal gland. Could you please label this for me?
So the outer one is the cortex, adrenal cortex, and the inner one is the adrenal medulla.
And how many adrenal glands do we have?
We've got two, which is placed on top of the kidneys.
Name the hormones secreted from these two parts and their function.
Two hormones secreted on this one. So for the adrenal cortex, we've got aldosterone. Was it aldosterone?
Anything?
I think aldosterone, which is for regulation of blood pressure. And the medulla is adrenalines. We've got epinephrine and norepinephrine.
And what you said about the next gland you want to discuss?
Pituitary.
Okay. Where is the location of pituitary gland?
Pituitary gland is located just below the hypothalamus.
Okay. Could you please label this for me?
Which one? No. These two? Is it the 1 and 2?
And or otherwise, which parts are located over here? This region.
On the green part 1. So we've got the pons, and then we've got the
What is this?
cerebellum,
What is this?
medulla oblongata.
After the medulla oblongata, what is?
Between the medulla oblongata and the pons
No.
which one?
After medulla oblongata, what is?
After medulla oblongata, it's the spinal cord.
And what we call this
Which one?
collectively?
This?
This one. What we call this area collectively?
Sorry, I
But
didn't get.
which part is the midbrain?
The midbrain is here.
Okay. What are two parts and state their function? Pituitary glands.
Two parts.
That you just name the hormones or secreted from
The hormone secreted in pituitary. So we've got the follicle stimulating hormone. So this one is stimulates the production of sperm, and then we've got the growth hormone, which is stimulation for growth.
Any other thing?
And then we've got the I've already mentioned growth hormone, and FSH. We've got also the thyroid hormone, which is stimulates the production of thyroid hormone.
Okay. Now moving to section 2, diseases of the nervous system. Which two diseases you want to discuss? Dementia, Parkinson, migraine, or stroke?
I'll discuss migraine and stroke.
Okay. Describe the condition, migraine.
For migraine, it's characterized as recurrent moderate to severe headache.
What are the causes?
Causes of migraine can be strong exposure to strong lights. We've got also strong smell or odor. We've got also stress.
And list 3 signs and symptoms.
3 signs and symptoms: sensitivity to light and loud noises, blurry vision, and then we've got also throbbing headache.
And 2 ways to manage the condition.
2 ways of managing: it can be lifestyle, which is can be stress management, and we've got also non-steroidal anti-inflammatory drugs, which is ibuprofen, can be used.
And any other medication.
Aside from that one is paracetamol and what's the other one? I forgot the other one.
Okay. According to New Zealand statistics, women are more risk to having migraine. Is that true or false?
True.
Okay. What other disease you want to discuss? Stroke?
Stroke.
Okay. Describe the condition, please.
It is characterized with disruption of blood flow.
And what are the causes?
Causes can be blood clot in the blood vessels. We've got also bleeding on the brain, and it can be a temporary blockage.
Can you name the 2 type of stroke?
We've got ischemic and then temporary ischemic, and then we've got vascular stroke.
Give 3 signs and symptoms.
Signs and symptoms: face drooping, arm weakness, and slurred speech.
Any other symptom?
Aside from slurred speech, weakness of limbs, paralysis.
That is
one
all
side.
comes under numbness or weakness,
Numbness,
face,
yeah.
arm, and that you already told.
Mhm.
And speaking difficulty. What else?
Aside from
What speaking difficulty or something like that? What else can be the symptom?
speaking difficulty,
Okay. hold on.
arm raising and all.
Give at least 2 ways to prevent the condition.
Preventative stress management, one. And then we've got also drugs.
Which drug?
Oh, that's already the treatment, right? We're talking about the prevention. So stress management and exercise.
And anything else apart from exercise?
Aside from exercise and stress management,
According to New Zealand statistics, stroke is the second largest killer in the country. Is it true or false?
stroke, yes, false. True.
Move into diseases of GIT. Which one you want to discuss? Gastritis, GERD, peptic ulcer, constipation, and diarrhea. You have to choose 2.
Gastritis and diarrhea.
Describe the condition. Gastritis. What happened in gastritis?
Gastritis, inflammation of the lining of the stomach.
What are the causes? 2 causes of the condition.
Can be bacterial, which is Helicobacter pylori, and overuse of non-steroidal drugs like ibuprofen and excessive alcohol consumption.
Give at least 2 signs and symptoms.
Signs and symptoms: we've got abdominal pain, nausea, and vomiting.
Give 2 ways to manage the condition.
Waste management: avoid triggers like eating spicy foods or anything with high acidic foods. Stress management as well. Exercise and doing yoga.
Is there anything like
Aside-
medicine which you can
Yeah,
give?
there are medicines that can be used as a treatment. So we've got PPI, or the proton pump inhibitors. We've got omeprazole for that. We've got H2 blockers, which is cimetidine and famotidine.
And next, moving to diarrhea. Describe the condition.
Diarrhea is frequent bowel movement, which is loose and watery.
Give 2 causes of the condition.
Causes can be food poisoning, or another one is water. Food poisoning, water, and it's food poisoning. And can be some medicines as well.
Give at least 2 signs and symptoms.
Signs and symptoms, frequent bowel movement, and then abdominal cramping and pain.
Give it 2 ways to manage the condition.
2 ways to manage the condition, eating low fiber foods like bananas and rice, and we've got also drugs with like loperamide and Imodium and ORS for dehydration.
Moving to the diseases of endocrine system, which 2 you want to discuss? Hyperthyroidism, hypo, diabetes, or Cushing syndrome.
Diabetes and Cushing syndrome.
Name the or describe the condition. Diabetes.
Diabetes is characterized as elevation of blood sugar level.
List 4 risk factors for the diabetes.
Risk factors, so we've got obesity, food intakes like high sugar level foods, and then can be genetics, hereditary or family history. One more, hereditary food. Did I mention genetics already? What more?
Okay. Give at least 3 signs and symptoms.
3 signs and symptoms: frequent urination, increased thirst, increased hunger.
Anything else?
High blood sugar level.
That is not.
Ay, that's the characteristics already. Polyuria. My goodness, mental block already.
Give 3 ways to manage the condition.
3 ways to manage. So we've got drugs to use as well, like metformins, and then diet as well.
Anything else?
Insulin.
Describe Cushing syndrome.
Cushing syndromes is overexposure to high content cortisol.
List some causes.
Some causes of Cushing syndromes can be endogenous or exogenous. So endogenous is more unlike within the body, which is like tumors like pituitary tumors, and then we've got hormonal imbalance and genetics. Exogenous is prolonged use of corticosteroids.
Give at least 3 signs and symptoms.
3 signs and symptoms: increased urination and thirst. We've got high blood pressure as well. Weight gain. Oh, weight loss for Cushing syndrome.
Do you remember the picture they have shown on this slide yesterday? What they were revealing? Who? Leah was the given with this topic.
With the symptoms.
The Cushing syndrome. What
Yeah.
she's shown in the diagram.
The person with hump on the neck and skin redness. Then we've got the face area is
How face
puffy.
like?
Yeah.
What shape we were calling it as a moon, like
Moon shape. Moon shape. Full moon shape.
gave at least 2 ways to manage the condition.
Ways to manage condition. So we've got medication use, which is ketorolac, and then surgery actually is the first line treatment. And then we've got also for lifestyle like weight management and stress management.
All good for today. We continue.